is Kelsey. I'm going to be your nurse today. I'm just going to perform some hand hygiene here. Okay, now I'm going to look at the wristband on you. Can you tell me your name and your birth date?
Kristen Ayers, 3/23/72.
Perfect. And can you tell me where you are today?
At the doctor's office.
Okay, and just for a quick neuro check, can you tell me who the president is?
President Trump.
Yep, that is true.
Although we're changing now.
We
but
are
yes.
changing. You are right. It's a crazy day. Okay, so I'm going to do a full head to toe assessment on you. I'm just going to ask you some questions. Okay, so can you tell me what your main problem is here today?
A bad cough.
Okay, and do you have any other symptoms today?
I've also been fighting some headache and sinus pressure.
Okay. Now, can you describe your cough? Is it wet? Is it dry?
It's a wet cough.
Okay. Now, does your cough come suddenly, or does it kind of come on gradually until you feel its full effect?
It kind of comes on suddenly.
Okay. Now, where does your cough felt? Like more deep in your lungs, or is it more kind of up in your head and sinuses?
My head and sinuses hurt, but I think it's like drainage down into my lungs.
Okay. Now, how long do your coughing spells usually last?
About 5 minutes.
Okay. Now, how bad is the cough? From like 0, no pain at all, to 10, the worst pain you've ever felt?
About a 6.
Okay, now, are your coughs usually regular, or are they sporadic, like they come at different times of the day?
Different times of the day.
Okay, now does this occur more in the morning, at night? Does it matter? Is it
Just throughout the day.
okay? Now, what makes your cough better or worse? Is there anything that helps it?
I try some cough drops or drinks of water, and sometimes that helps temporarily.
Okay. Now, when you cough, is there any sputum, phlegm, anything that comes up?
Yeah, usually kind of yellowish phlegm comes up.
Okay. Now, how often is there sputum and phlegm when you cough?
A couple times a day, I'd say, where phlegm really comes up.
All right. Now, are there any medications or home remedies that you use?
No, just for the sinus pressure, just take Advil and cough suppressants.
Okay. Now you said you've been feeling some sinus pressure. Can you rate that pain from 0 to 10, like I said?
About a 6 also.
Okay. And you said you take the Advil for that, correct?
Mm-hmm.
Okay. Now, have you had any other sinus problems, such as postnasal drip and congestion, anything like that?
Yeah, just headaches and some drainage kind of down the back of my throat.
Okay. Now, do you have any nose problems that come with that, such as bloody noses, stuffy nose? Can you not breathe out of one or the other?
No.
Okay. Have you had any changes in smell?
No.
Okay. Do you have any past history of respiratory illness?
No, just an occasional sinus infection.
All right. Now, do you have any allergies?
Nope.
Okay. Any history of nasal or chest surgery?
Nope.
Do you use a CPAP or BiPAP machine?
Nope.
Do you have a history of COPD, emphysema, asthma, cystic fibrosis, chronic bronchitis?
Nope.
Nothing like that? And no family history of that?
No.
Okay. Are you a smoker?
No.
Have you ever been a smoker?
No.
Okay. Now, when you sleep, can you sleep lying flat, or do you need a few pillows or the head of the bed raised at all?
Usually a few pillows. If I lay flat, it tends to make the cough worse.
Okay. You're good. Okay, now this is normally where I would take your vitals, but for this assessment, we do not need to do that right now.
Okay.
Okay, now is there any pain right now that I should be aware of?
Nope, just in my sinuses.
In your sinuses. Okay, I'm just gonna check your ears, make sure there's no drainage there, no lesions. Okay, now I'm gonna check your pupillary reflexes, okay? Alright, so. Okay, give them a minute to adjust. Okay, both accommodating well. Okay, now can you stick out your tongue for me? Check in there, no redness or lesions. Now to check your tongue movement, can you stick your tongue out for me? Go up and down, side to side. Move it, all right, perfect. Okay, so now I'm going to test your eye muscle movement, so I'm just gonna have you follow my pen light. Side to side. Corners. Okay, perfect. Okay, now I'm gonna check your facial movement, so can you smile for me, frown, raise your eyes, and puff out your cheeks? Okay, perfect. Okay, so now I am going to check your neck muscles. Can you lower your neck for me, raise it up, side to side, turn your neck? Okay, can you push against my resistance, raise your shoulders? Okay, perfect. Okay, so now I'm going to auscultate your carotids. So, just gonna listen real quick for any buoys or any abnormal sounds that I hear. So, okay, so I'm gonna have you breathe in and out for me. Okay, one more time. Okay, and I'm gonna just check this side, in and out. Okay, in and out. Okay, I'm just gonna check those. And I'll check the other side, make sure it's even. Okay, now I'm gonna check your heart sounds. So, all right, do you care if I go under the shirt a bit? Okay. All right, so I'm gonna check your pulmonic, aortic, mitral, and temporal or tricuspid. All right. Okay, so now I'm gonna listen to your lung sounds. So I'm just gonna have you raise your neck and take a deep breath in and out for me. Okay, same here. Okay. Now, same thing as last time, just take a good deep breath in and out. In and out. Okay, one more time. In and out. Okay. Now, I'm gonna check your arms, make sure there's no lesions to be aware of. Range of motion, check your capillary refill. Okay, other hand. Okay, perfect. Now I'm gonna have you lie down for me. Okay. I'm going to have you turn your head away from me. Okay. And turn it back. And then turn to the side. Okay, no jugular distension noted. Okay, so I'm gonna lift up your shirt real quick. Just rotate your abdomen for any abnormal sounds there also. Okay, no lesions. Okay. Okay, sounds there. Sounds there. Okay, sounds in all quadrants, that's a good sign. Okay, now I'm just gonna lightly palpate. Tell me if you feel any tenderness. Okay, perfect. That for you. Okay, now I am going to have you sit up again. Sit up back towards me. Now I'm going to check your posterior lungs. Okay, breathe in and out for me. Okay, perfect. Check your back for any lesions, pressure. Nope. Okay, perfect. You can swing back towards me. Okay, now I'm just going to check both of your pulses. Your pulse here. Okay, both even. Okay, do you care if I take your shoes and socks off, ma'am? Okay. Okay, those. Everything looks fine. Check the capillary refill on those also. Okay, now I'm just going to check pulse on both of these. Dorsal pedis, make sure they're both even. Okay, and then your posterior tibial. Okay, perfect. All right, so for your ankles, can you lift one of them up for me? Make sure you can go up, down, side to side. There, okay, other foot. Up, down, side to side, no pain?
Nope.
Okay, now with your wrists, can you go up, down, side to side? No pain on those either?
Nope, they're fine.
Okay, perfect. So now I'm going to have you stand up for me. And I'm just going to have you walk towards me, make sure your balance is all right. Okay, now can you walk back for me? Okay, I'm going to count for 20 seconds and have you stand with your eyes closed, okay? Okay, perfect. Okay, that completes our head to toe assessment. Doctor will be in to see you shortly.
Thank you.